Thank you all for being here today. Taking some time out of your schedule to hear about our next level program and hear from some of our wonderful partners and clients in the San Antonio area. Today is directly about hearing about some of the challenges that they face or any of our employers that you guys might be facing, i.e. rising premiums, poor access, frustrated employees, and how they approach those challenges differently with the Next Level Prime program. We have 6 organizations represented, each with a different workforce, each with different needs and different pressures, and that's exactly why we wanted you to hear from them. So I'd like to introduce our panel before we get into any of the questions that I have ready, and then we want to open it up for you guys at the end. So first and foremost, Frank Stanich is the Assistant Superintendent of Operations at Alamo Heights ISD. And then we have Albert Castillo, CEO of San Antonio Eye Center. And then my illustrious boss, Dr. Juliette Breeze, MD, CEO of Next Level Medical. Beverly Hubbard is the Employee Benefits Coordinator with Carbondale ISD. Bonnie Heron is the Director of Human Resources for Sherrod-Citadel Universal City ISD. And Sean Altis is the Talent Manager for Cox Manufacturing. So if we can just give them a round of applause real quick for taking the time. All right, guys. I'm going to try to keep this light, but that's just my personality. Okay. My first question is for my boss because I want to keep my job. Dr. Breeze, I've had the pleasure of working with you for 12 and a half years, and you've always been an innovator in this healthcare space through your various roles. What was the spark that ignited you to create a program like Prime? And is it today what you imagine, and what's on the horizon as we continue to grow?
Well, first of all, can you hear me? Okay. Thank you so much for being here, and I am here today not only because they forced me, but also because I am an employer. And the reason that you're all here and that we have clients is that I was an employer struggling with a really big problem, which was that my employees, even though I was spending millions actually of dollars on healthcare, they didn't think that we had a good benefit. They weren't impressed. They had high deductibles. They were using care inefficiently, and we provide care. So it was a little bit embarrassing to me that we had a high utilization, especially with family members using freestanding emergency rooms and using things at hospitals. We had a lot of people that were using the wrong level of care. They were going to, the hospital when they didn't need to, and so I had rising costs and an unimpressed workforce with what we were providing. I also got a chance because I'm not only an employer, but I'm a medical provider, and I actually got this really cool insight. Because when we started Next Level, we started it to be an option for people as an urgent care. We were really trying to be a low-cost alternative to the more expensive emergency rooms that were in the neighborhood. But because it was a little bit tough to get started as an urgent care, because people don't use urgent care every day or week or month, they sometimes take a year before they come back to us, I had to do something to get patients in the door and frankly revenue in the door. So what we did was we took a job working for a county that had an on-site clinic. And the on-site clinic was a really kind of cool little experiment for us. We got paid a flat rate every month to basically manage this clinic. And what I loved about it was that the employees really loved it. They didn't pay anything to use the clinic. And they also, they were more compliant because it was like very convenient for them. On our side, my staff loved it because they didn't have to talk to people about money. And when you go into healthcare and you want to be a healthcare provider, and you end up feeling like you're shaking people down all the time, it's no fun. No one wants to do that. So I had this situation where I was like, this is a really great model, but it doesn't work for most employers because most employers don't have all their employees in one central location, and they don't have enough employees to make it work, or they might have employees in different dispersed. And also, it's not ideal for when you want to provide care for families, because family members don't love to come to the workplace to use an on-site clinic. So I got the thought of, like, what if I used the clinics that we've already put out as urgent care, and we use those as access points for care in sort of a similar model. And that's sort of the birthplace of the idea of our Prime program. What happened that really kicked it into high gear was COVID, because in COVID, we had to add a bunch of services that we didn't really know how to do before. So we all of a sudden became telemedicine providers, and we added mental health because everyone was falling apart, and then we also added lab because lab was a really big problem for us in COVID times. And when we were coming out of COVID, I kind of took a look and said, wow, we have all the components of a really rich primary care offering that we could offer to anyone. The problem was that, like, nobody wanted to take me up on trying it. So I did it on ourselves. I basically put a certain amount of money every month away, and I said, okay, what if I was an employer, I'd be paying for this, so I'm going to put this money aside, and I'm going to see if at the end of the year, if this was a good idea. So that's what we did, and we escrowed that money, and we told our employees, hey, for anything that you or your family members need this year, it's free if you use our services. If you are using anything the next level, which is urgent care, primary care, preventive care, it's care navigation, it's health coaching, it's mental health, it's lab, all these things. At the end of the year, we had saved $500,000 on actual medical costs. We're self-insured, so we were basically not paying $500,000 worth of stuff that we had been paying for. That was mostly emergency room diversion, to be quite honest, a little bit of lab, but mostly emergency room diversion. And then what was really interesting was that our stop loss carrier came back to us and said, we're actually giving you a decrease. And I don't think anyone ever has received something like that. I was like, floored. What? I didn't even ask, and they said, well, you just don't have any claims going through. Like, where did all your claims go? We can't really justify the cost that we're, charging. So that was super exciting. And then the last thing that happened was that we noticed that our employee retention numbers were up. So we were keeping employees at a higher rate, which was very exciting because that is a very costly thing for us to onboard and train and hire new people. So I thought we might be onto something. And now I just have to take it out and figure, well, all employers are going to love this, they're all going to want to do it. Except that I didn't really understand how it all worked. And so we went out to employers and we told them about it. And first of all, they were very nervous because, it was new and new things are scary. But then the other thing was that they would say, well, our broker didn't tell us about it, so I think we just need to go talk to our broker. And so then we had to have a whole other community that we had to educate and talk to and reach out to. So it took us a few years to sort of break in, and now we have over 500 organizations on membership. We have over 115,000 members, and we are really proud of the program and really excited to be here sharing it. Oh, you did ask me what's coming up next. And I do want to just throw this in because that's what I'm working on. I'm really excited about it now. One of the things that I am hoping to accomplish is, we are a membership that spans Houston, Austin, San Antonio, and Beaumont. But we know that there are employers that have employees all over the place. And it's been this problem that I've been trying to solve. Apparently I should have just I should have asked a friend, but I couldn't figure out how I could grow fast enough to put locations in all the places that we needed to be in. And just over the past month, I've started basically arranging contracts with affiliates where they can provide the in-person care in their clinic locations, and we can still maintain the app relationship and the virtual services. And so that is expanding rapidly, and we're hoping to covering more of Texas, more of other states. We're going to be expanding, so that's our exciting news.
Thank you, Dr. Reeves. I want to throw out a question to Frank and Albert. You two, and I'll start with you, Frank, and then go to Albert. But you two were two of our early adopters of the Prime program, and nobody really understood what we were doing with the program in the San Antonio market. So what was your process to start a relatively unknown program, and how did you sell it to the employees?
Well, it all started with Amy up there, Amy Platt. She came by and talked to our health services coordinator for our school district. And Kathy was her name. Kathy came and said, hey, Frank, we got to check this out. So with any expenditure, it sounded very promising, but we needed to do the numbers. So we took a look at our claims data and saw like which claims could potentially be taken care of by Next Level. And we projected that we could save over $300,000 in the first year. So that was a huge selling point when it came to talking to the board. As we delivered it to our employees, we had to promote it. And the Next Level provided some materials to us to get the word out to our folks. But really, it took a lot of effort to stand the program up. We had Rafiq, we had Amy out. They were at our health fairs when we had people come out for information. And then I looked back through those emails when I was preparing for this panel, and I saw that early on when we stood it up in September 2023, we were doing a lot of work, trying to promote it, solving problems. But slowly, I'd say slowly, about halfway through that first year, it really started kicking. So we knew that we were onto something. In the second year, we went fully self-funded on our own. We moved away from the TSHBP. I don't know if any of you all had that. But at that point, the real payoff started, because now we're talking about putting money back into our budget instead of it going to our insurer, and then getting the benefit of no longer having those claims. We were able to pay ourselves, and what that resulted in was a 9% renewal rate for our stop loss this year, and which was very favorable considering the conditions. And knock on wood, we're looking pretty good. So just that initial start, do your research, I think, be prepared for the tough questions that the board is going to have for you, be able to show them the numbers that we project. Ultimately, this last year, after we take out the money that we paid Prime for the services, we netted over almost $1 million, and that's for 600 employees and family members.
Yeah. There we go. I'll just hold it. Thanks for being the road.
This was a tough issue.
The rest of it was very easy to transition. Your microphone. There we go. Thank you. That was an easy thing for us to do, primarily because we had already worked with capitation. In San Antonio, we're the only eye practice that takes care of capitated patients. So like Dr. Breeze, we're very familiar with being paid a lump sum of money for a subset of patients. That's a lump sum of money for us. Wow. Thank you. A lump sum of it's me. There you go. They're really sharp. So we get paid a lump sum of money to provide care to a subset of patients, a group of patients, and so we're very familiar with it. Having worked in healthcare, I'm also very familiar that healthcare employees are the highest utilizers of health insurance benefits because they know how it works. So they're going to go to the doctor, they're going to utilize the benefit, they're going to take advantage of, I'm able to go to the ER and I'm not going to pay my deductible in the hospital. Oh, they will send me a bill and maybe I pay it or maybe I don't. And so they just know how to use the benefits. So we had really high claims, our insurance premiums were going up, our deductibles were high, employees weren't happy. And so when they brought this to my attention, and I was already looking and educating our employees as to, let's make sure that we go to our PCP when we can, then let's go to urgent care, then let's go to the emergency room. Here are the different things you can, that will lead you along the way so that they can make good healthcare decisions. They just didn't do it. So I knew what this was going to cost, and I said, well, let's take a shot and see what it does for us. So it was a really easy decision. I'd say after the first time I met with Pete, he signed up, and it's been working for us. Our employees absolutely love it, and it's really helped us with premiums and reducing the claims that are on our paid full insurance.
And just to note, Albert started on an HMO plan initially, and now they're level for 3 years with the Prime program. So that's something that we're able to do, because we hear a lot of times that fully insured clients aren't necessarily our appropriate targets, but they are with the strategy. If there's a strategy that you want to go level funded, then let us partner with you for a year or two and get you onto a level funded program, because we're going to keep the claims. That's my last commercial, but okay. So Beverly, I don't know which mic you can use. So before Prime, Beverly, what were your biggest challenges with employees getting timely access to care, and how did that impact your team?
So before Prime, employees were reporting difficulty making an appointment, a timely appointment. So if they're feeling ill and they would call their PCP, maybe it's 2 or 3 days before they can be fit into schedule. So they have to consider taking that amount of time off of work. Maybe they don't have that in their bank. Maybe they're just feeling very poorly, so then they have to make a choice. Do I go to urgent care? Do I go to a different PCP? Do I need to shop around at this point? And they're tired, they're vulnerable. Prime eliminated that, because the access to appointments, and if you use the app, you get familiar with the waiting line, and it tells you when you can go ahead and drive over to the clinic. It's usually within an hour, if that, and then you're ushered right into a room, and they're seen very quickly. So Prime eliminated that issue with timely appointments, access to care, and the financial burden of receiving healthcare for our members. I can't even tell you how many times in the past couple of years that I've received a call from an employee, and they were like, I went to Next Level last night, should I expect a bill in the mail? You're a Prime member, it's covered. The appreciation cannot be overstated.
Thank you, Beverly. Bonnie, after rolling out Prime, what challenges did you notice first in employee behavior or feedback?
As far as rolling out Prime, the changes and feedback, initially what we heard was a lot of, this is too good to be true. Like, this can't be right. Like, you're telling us we can go there and we can have any number of these services done, and we're walking out and we're paying $0. Yes, that's exactly what we're saying. We're investing in you guys as a benefit, and we're paying the membership fee for you to run your access to care. And it was a little bit slow at first, and then as the employees began to utilize it, we're fortunate we have a clinic very in close proximity to our district facilities. The word of mouth among the employees began to spread about the experience that they had getting to the clinic, the ease of the experience, the opportunities to utilize the app if they didn't want to step away. Teachers are notorious for not taking good care of themselves because it's harder to step away or be out because you've got to prepare for a sub or all the things. So just the convenience factor alone of being able to, on your conference, check in and be seen virtually or run over to the clinic. It was just again, initial hesitation was just, it seemed too good to be true. But then the word quickly began to spread, and we couldn't get folks signed up fast enough.
Thank you, Bonnie. Now, Sean, you have a predominantly male, blue-collar workforce. Has there been any setbacks, criticisms, or concerns from your employees? And if so, how were they addressed and or resolved?
So we have 200 employees in manufacturing, mostly male, blue collar, and when we transitioned to Prime, we were coming from probably 5 years of frustrated healthcare usage being self-funded. We didn't have the right recipe. We had the best of intentions. So when we rolled out, hey, we've got this new thing, and finally all your problems are going to be solved, they were like, yes, right? Oh, y'all are going to save money. That means it's going to suck. It's going to be cheap for us, right? So it took us 6 months alone. This is our first year. It took us 6 months alone to finally convince everybody it's actually free, right? Like we just paid for the membership for you. Like it's not free, but you're not going to pay anything. Just show up and try to put them out of business, right? Try to break the system. Like, let's see what happens. If you don't believe me, try it out. And so that was our front office team. That's what we just coached them. You know, someone comes up, how do I use it? Call it, open your app, go in. Just whatever you got to do. Use your app or go in. Prove to me that it's going to cost money. So there's like a lot of skepticism, and like that was our biggest initial hurdle. Like I said, this is our first year using it, 11 months in. The only other hurdle we had initially was, hey, I downloaded the app and I went in and they're trying to charge me money. You said it was free. I knew it, right? Y'all suck. So we just got really good at forwarding them to our account manager at Casella. And we just say, hey, you gotta solve this problem. And they did a great job, right? It just handled it was the first time since I've been in HR at this company that we actually got good feedback with our healthcare was this year. And it was just incredible. Feel cared for, and I just can't say enough good things right now. So.
Thank you, Sean. So if you guys will raise your hand, because this is for anybody here, and we'll go in order, but Albert, you'll speak last and she'll make the point. Yeah, two of them, it's you. What were the earliest signs that Prime was actually working for your organization? When did that light bulb go off for you as the administrator of the program?
Well, at least 2 months into the program, we saved at least 25 ER visits. And I feel like the utilization report that we receive monthly, is really conservative on how much an ER visit actually costs the plan. So at 2 months, we've already saved 25 at least that we love. That, I mean, are you supposed to quantify that?
Anybody else?
So for us, sitting in the chair, we have some. Are you doing this randomly? We have some HR people in the room, and I knew that we were onto something when I started getting the positive emails from our employees. I mean, never got a positive email about medical coverage, But when it came to the next level, we started to see the utilization numbers go up. As Bonnie said, that report is invaluable as you're monitoring the use. So it just started taking off, and our teachers started talking to one another. One statistic I think that everyone in the room should be aware of is that, and this is from a couple of years ago when we were looking at Next Level Initiative, is that they're predicting, and there currently is a severe family practice physician shortage in Texas. Some estimates 25% less than what we actually need. So for us, our employees picked up on that because they're the ones who have had difficulty making appointments with primary care. And all of a sudden they can get on the phone and talk to someone like that, or they can make an appointment or walk in 24 hours a day. And that was a game changer. That's when we really started talking, because not only are we saving money, but we're saving time, and they know how much we appreciate that.
We knew this thing was working when two of our biggest naysayers in the company said, holy crap, this is the best thing y'all have ever done for us. Thank you.
Hopefully this works with me. We knew it was working for us pretty quickly. Shortly after enrollment, our employees started using the benefit pretty quickly. As I said, they're pretty familiar with insurance. I knew it was working because every time there was a problem, Rafiq answered his phone. So I was happy that Rafiq was available because he was my primary point of contact to deal with all of our problems in the beginning. And he did get a lot of phone calls at all hours of the night. So thank you.
All right, so this question is for Juliet, Frank, and Albert. Let's talk dollars. I'm gonna start with Frank, and we'll go to Albert and finish with Lost Day. What cost improvements have you seen? You've already kind of talked about some of them, but whether that's ER avoidance, lower claims, fewer high costs, episodes, or reduced absenteeism. So, Frank, what have you seen in Animal Heights since 2023?
I was looking anecdotally at our absence management system. Anybody here use Red Rover in all of our districts? A few people. But one thing it allows you to do is to go back over time and look at absentee reports. And I don't know, I can't attribute it to any one factor, but our absenteeism is going down. But the cost savings have been huge. And, I mentioned the numbers earlier, to put 400,000 in and to get a net back of almost $1 million. It's, in any business, you would jump on that right away. Seeing our people invest in their own health care is probably the biggest thing. Rafiq shared an email with him from one of our nurses talking about how she was concerned about this employee who had hypertension, diabetes, was just, total morbidity going on. And since we got next level, this employee has pulled himself up, is taking control of his own health care, and is a different person today. And, so we see things like that, and we're just like, how can you put a price on that? But ultimately, it's the morale, because those stories belong to our culture, to our district, and people who work in our district know that we take care of our folks.
Albert, Reverend Mike.
Yeah, I think for us, it's worked very well. We've seen a reduction in claims, of course. It certainly has helped with a reduction in absenteeism. It's very convenient for employees when they can go after hours or they can do telehealth visits, so it's really worked well to help them. I think the most important benefit that it's provided to our employees is that they don't have them out of pocket. So for them to be able to go get the care that they need, they're not getting billed for deductible, they're not getting sent to collections, it's not being charged against their credit report. It is advantageous for employees. We have a lot of employees who are probably, in their early 20s. A lot of them are single parents and single families. They don't have a lot of education and, background behind them. So with that type of employee, it's allowed us to give them the resources and means to take care of their families in a way that they probably couldn't have done otherwise, because otherwise they would have only had insurance for themselves and probably not for their family. They probably would have been on Medicaid and utilizing those benefits or some other type of benefit that's provided by the government.
I mentioned the first year, but actually having gone forward and now, just as people were talking about, over time, more and more employees understand how to use it, and you get better utilization as you stay on the program. And for the last 3 years, we have not raised our employees' contribution to the health care at all, because we have actually kept our premiums flat. Like, our insurance renewals have come in flat, which, if you have gotten renewal this year, most people are getting, somewhere between 9 and 20% increases. And that's super exciting for us. And it's all based on basically just removing claims. We're just not 80% of what my employees go in for doesn't even ever hit the claim. So that's been really exciting. The other thing, again, that I can't stress enough is employee satisfaction, employee retention. And one day I'm going to have the time to do the right study where I actually quantify how much it costs to replace each person who leaves, and put that out as a real number. But I know that we've saved a significant amount on just not having to, because people don't. I've had a few employees tell me, I couldn't get $0 healthcare from anywhere else. So now, if some of you guys sign up, they might be wrong, but yeah.
All right, now, when we talk about healthcare, everybody's worried about open enrollment and implementation. So this question is for Bonnie, Beverly, and Sean. You know, many employers worry about implementation and how difficult it is. What was your experience when you did your implementation for Prime? And what would you tell someone who is hesitant? So I'll start with Bonnie.
So I will have to say, I was telling Dr. Green this story earlier, we were probably a constant case of how not to do this. We were actually already in the middle of our open enrollment before we were able to secure a final decision from the powers that be to move forward with Prime. So we already had folks that had enrolled. We were now having to get it added to our enrollment portal. It was terrible. But I cannot express how supportive and responsive the Next Level team was in working with us and getting all the pieces into place. You know, like, we didn't have a lot of front end marketing that we had done because, again, are we doing this or we're not doing this? Like, we really kind of need to know. And so they jumped in high gear and supported us in that respect. We were able to get the word out. And, you know, it was not as, like I said, not as timely as we would have liked to have done, but we were able to push it out. We got employees signed up, and as they started to utilize it, it was very successful in the sense that after the fact, we had so many people, so many employees asking to, hey, I didn't sign up for that. How do I get in? Or, hey, can I sign up my family members? That we ended up having a special enrollment that we opened up in January just for Prime as an add-on. And again, Next Level was there every step of the way to help facilitate that and to make that as smooth as possible for our employees who, by now, word of mouth had spread such that they wanted it and they were invested. Hey, I want to pay $0 for this and get care. So for us, it was a great experience. Even the fact that it was clunky and that was solely on our end. They worked it out and it was great. To me, it's a no-brainer. It's a win-win. It's been great.
Beverly?
When we were approached about Prime, I think I said this out loud. What's the catch? There wasn't one. That was enlightening, that there could be an option, that our members could receive primary care at 6 o'clock on a Sunday to go get their annual wellness exam. They didn't have to take a half day off. If they had a broken bone, that could be managed very, very easily. And those things weren't going to hit our plan. Chronic diseases, mental health, all of those things can be accessed through Prime at the employee's convenience. And so what I would tell somebody or an organization that was considering this, look at your actual plan spend if you have access to it. Consider what could be diverted from those funds, and employees are going to have a better experience receiving healthcare the way it should be. It's not a burden anymore. They take that barrier away.
I just want to add one thing. One of the things that I know that some of our organizations really, it's just too cumbersome to do anything outside of open enrollment, but we are not an insurance program, we're not attached to enrollment, and an employer who wanted to put the program in could do it anytime they wanted to. If they could just get the communication out to their staff. So I just wanted to add that. So I think Bonnie did a really good job of explaining, sometimes how chaotic open enrollment can be.
Our implementation was pretty simple. We emailed all of our employees, said, hey, this thing is coming. Then we texted them all a 3-minute YouTube video, said, hey, this thing is really coming. And then we had our broker and Rafiq and Sarah, our account manager, to all come out and say, hey, this thing is here. Download the app, let's go.
Gotta love Sean Short. He speaks to his audience. I love it. All right, so Bonnie, Frank, Sean, employee engagement is also the make or break factor without us being redundant. When we're talking to our monthly meetings with you about employee engagement and how we can adopt, is there anything that you've seen, or how do we ensure that employee adoption is available for all of your members?
So for us, one of the things that we did was we made sure to never miss an opportunity to speak about crime when we had our employees in front of us. Early in the year, and again, this is speaking from a school district, we kind of make a road show and visit our campuses, and we're doing service awards, and we talk about benefits, perks of the badge, all the things. And we took an opportunity to always speak about next level crime and what benefits came with that. And then we quickly learned that we would just bring it up, and the employees were eager to talk. They wanted to, raise their hand and wanted to share their personal experience that they had. And that was really beneficial because, oftentimes I'm sure they think the message that we're delivering from HR, we're sugarcoating it, right? But when their peers begin speaking about it and speaking of their positive experience, and it really goes a long way. So that excitement among the employees did really take off. And then we just, in addition to just going to the campuses, whenever we had our leaders in a meeting space, we often carve out time to talk about wellness and benefits. And we just, again, made it a point to speak about things. And okay, so everybody grab your phone. If you can show me that you've downloaded the Next Level app, or pull up the Next Level app, or whatever, and just getting that excitement and getting that interest, and giving them, incentives or little trinkets that we swag, wellness swag. That was really what helped with building engagement. And then when we did that with the leaders, we would of course encourage them to turn that around to their campus teams or their department teams as well. So just, again, not missing an opportunity to talk about it. The other piece that we did, honestly, I'll go ahead and throw this in here too, is we educated our employees. Many of them had no clue how self-funded insurance worked. And so when we talked to them about that, and explained that you're paying the claims, your monthly premiums, and that's covering the claims. And when we utilize a service like Next Level, it's helping us. It's a win-win. You're walking out, you're paying $0 for your treatment, but we're saving the dollars that would otherwise have been pushed through as a claim. So when we can generate enough savings, what we can do then is explore other opportunities to enhance the benefits that we already offer, whether that's covering the full premium for your insurance, or offering free generics, or however we want to post that. But when they had a better understanding of how they played a role in that, it made a lot more sense, and there was quite a lot more buy-in, I would say, at that point too, with utilizing the membership.
I want to tack on to what Bonnie said. It's so important was educating the workforce on self-funded. That was the turning point for us as a result of our regular updates with the seller and the fee. We started looking at the numbers and how many people are visiting the clinics. Not only was that telling us that we were on the right track, we were seeing the numbers go up, but also gave us something to share with our employees. Something that they knew that they had a hand in keeping their potential future premiums as low as possible. And the way to do that is by getting all of their possible medical care through Next Level, because it's free of charge to them. And also it keeps us from having to claim on their insurance. The utilization rates that we went over every month were really great because they told us that, we were doing the right things. Our net promoter score was going up, our utilization rate. In September, out of 1,214 registered members, that's employees and family members, 271 of those folks going into a next level clinic or contracted next level in the month of September. That's just one month. And to me, getting that report from Accelis last month told me that really we're where we want to be. People are managing their health care, they're being proactive, and we see that in the morale. So the reports have been very good.
This answer.
We just told our naysayers, every time we got good feedback from our naysayers, our loud employees, we said, hey, will you go ahead and tell 3 of your buddies that?
Sounds like I couldn't wait. All right, for the entire panel, I'll start with Dr. Breeze. So it's so hard for me because I want to call it JV, that's what I call it. Dr. Breeze and Beverly, but if there's one story, without names, unless you want to provide the name, for Prime made a clear difference from an employee that you can remember, something that stuck with you, resonated with you.
Well, something that we haven't talked about, which I'm really excited about, is our GLP-1 program. And when you are, when you have a Prime membership, then you're also offering your employees an elective program where if they want to lose weight using some of the GLP-1s, they have a very deeply discounted program. So for Prime members right now, semaglutide is, which is like kind of similar to Ozempic, it's $189 a month. And so we started using, we offered that to our own employees, obviously, and we had 3 employees who were extremely unhealthy, were racking up tons of medical claims. And all 3 of them decided to take advantage of the program. And today, I actually just went into one of ours. We have 1,000 employees, but this one is just like so near and dear to my heart because she's a wonderful person and a really good cheerleader now because she has lost 155 pounds on the program. And because of that, she is off of all of her chronic meds, and she is happier than I've ever seen a person. Like, it's just really exciting to see that. And she told me, I've never taken this step, but it was just really life-changing for me. We have 2 other employees with similar stories, so those would be my goals.
Beverly?
So something that sticks out is fairly recently a newer employee, new to the district, new on the plan, called me. And this is not an uncommon thing, but this one particular employee was expressing concerns over things that were happening at their home, stressors at work, and they weren't feeling well. And all of these components were compounding to just bring them down, and they were asking for help. So I reminded them that they had Prime with the medical plan, and there was a mental health component. You could speak with a counselor, and they took that option. They sought care for their illness. I don't remember what it was, but then they also did the counseling sessions, and so the whole person approach that was taken with this one person really spoke to the level of customer service that everyone receives. This person wasn't, different from anybody else, but they felt important, and that made a difference to them. That was one.
Thank you, Beverly. Anybody else want to add? All right. I'm going to ask one more question, and I'm going to open it up for questions before closing. But we kind of talked about this earlier, Albert, but I'll start with you. But how has Prime influenced the way you think about your overall benefit strategy or renewal strategy? And
I'll start with you, Albert, and then I'm going to go to Frank and then Bonnie.
Yeah, for us, it's pretty much part of our benefits package. We used it as a way to educate our employees. That's probably the primary thing that we do. Using Prime, the other thing that it's helped us with is twofold. From a financial perspective, all of our employees get a 15% profit share of the profits from the company. So if we're able to educate them that by utilizing these services with Prime and it saves us money on the premiums, then that also helps them because they get this at the end of every year, so there's a profit share. Additionally, if there's money that is left over that we've been able to save in other ways, we've been able, for our health insurance premiums, we've been able to use that to provide other benefits to our employees that maybe we didn't have, or increase our 401k contributions. So we're able to help educate our employees that by doing this and by utilizing the benefits smartly, it allows the organization, the company, opportunities to do more for them outside of just healthcare. So that's the one thing that we've used it for.
So for us, saving the money was a game changer because now we're looking at other things. To save that much money, can mean pay raises for all your employees, which makes us more competitive when it comes to looking for good people. Also on the horizon is trying to really, we've got a fundraising on in our district, trying to raise funds so that we're insulated from the whipsaw of the Texas legislature's funding formulas. We have to make hard decisions all the time. And, if we can raise enough money to build the corpus of our health plan, then we'll be totally insulated from the market forces that drive healthcare. I think that looking in the future with the benefit space, this model that Juliet and her team has put together fits in other areas. Albert's Eye Clinic does direct care. There are benefits folks out there that do like one price for procedures, direct care for knee replacements and other things. So I think that as you're able to build the corpus of your self-funded plan, you're going to be able to take more opportunities like that because you're more insulated from risk.
So for us, yeah, it's absolutely been a driver in how we look at benefits and again, I think I mentioned it earlier, we really look at Prime as a win, and we had to start getting creative and looking at opportunities that are not just wins for us, but wins for our employee. And when they can go in and get quality urgent care or primary care that saves them a copay, and some copays may be $15, $20, but to some of the folks that we employ, that's a significant amount of money that they're leaving in their pocket, especially when they have young children and they have multiple visits to take, the kids get an ear infection in the evening, or it's money that they're saving, but also it's saving us money. So exploring it, looking at it as a win-win, where they can win and we can win. But beyond that, we've had employees verbalize they don't want to leave us. They would never consider leaving our district, or certainly not leaving us unless another employer offered next level Prime, because it has added so much value to their life. And the other piece of that is speaking to the value that it's added, to the point where many of them are, we're covering their membership as the employee, but they're willing to then in turn invest their own dollars to buy up coverage for other family members. Even our employees that maybe don't take our insurance, they, via payroll deduction, are willing to pay for the membership and cover their families as well. So again, that it speaks to the value that it is in adding to having that as a benefit offering to them.
All right, thank you. Does anybody in the room have any questions that they'd like to ask? All right. Sue, I know you're loud enough. You don't need a mic. I got you.
No, I don't need one. So with the implementation of the app, I know that Next Level's app is actually pretty next level. It does biometric screening. Have you seen an actual increase in utilization through those features with your employees in Max Health benefits.
Yes, so there was the education piece with the app, and we spent a little time on that. But I think that our employees are almost exclusively going through the app now, whether it's making the appointments or doing the virtual care. And the biometrics are pretty cool.
Yeah, the feed showed it to me a couple of times, and it's shown it to some people I work with, and it's awesome, so.
I do have to throw in that our app is continually improving, and we have a really exciting new features coming out very shortly, probably in the next 2 months, which will really help patients to better understand where they can get care. For example, it's going to allow patients to just speak into it and say, you know, my ear hurts, and then it will give them the option. So we could actually get care through this algorithmic thing where you don't have to even make an appointment, just go and do it right here and we'll send you your medicine. Or you can get a virtual, or you can get an in-person appointment, and it'll show them the different options and what's the easiest and quickest. And so we're trying to make it so, you know, just so convenient for people.
Thank you. Next question, how does pharmacy and medication work with the program?
It works actually the same way as a regular doctor's office does now. I'm working on that too. I'd love to put pharmacy in this in some way. It's a challenge right now. I know I could do generics, but like, you know, the full breadth of pharmacy is really hard because of the way that we have pharmacies structured in our country. But right now, a patient puts in what pharmacy they have, and we send their prescriptions to whatever pharmacy that is, and their pharmacy benefit that they get through their employer is what covers that, you know.
Let me add that in the app, there's also a prescription savings tool. You can just type up anything that you would like to of any drug, and it'll show you the cash pay price within the 4 nearest locations. And that in itself is an eye-opening experience sometimes when you're just looking at that. And so that's available. And another thing that we do as part of our implementation is that we ask for prescription phone number. So we want to know, it's just part of our program. And so if there's anything that we can do to make sure that we're not writing anything off the formulary, but I would say, I'm not a doctor, this is taking the health last night, but I would say that most of our prescriptions are typically generic. I'm the only drug rep that she's ever liked, and that's what she tells me. And so I used to be a drug rep a long time ago, and I'm the only one that she'll put up with. So she is not a fan of prescription drugs that cost a lot of money, but she's all a fan of drugs that are efficacious for patients. Any other questions?
I know you said you're only in Texas, and I have schools in Arizona. And you said you're going to partner with other, okay.
Yeah, if you let us know where you are and how many employees, we're basically making deals right now with several large organizations that have locations across the country, and they're really interested in this program and helping to basically collaborate on it so that we can all basically offer it to more employers across the nation. So Arizona is certainly a place I've been asked for before. So let us know what city or
Phoenix.
What area. Phoenix, yeah, okay.
I think she said Scottsdale or the golf course. I'll go.
I'm gonna take one of the team. Thank you.
Same. I got a little experience in real estate. Any other questions?
With the ability starting in 2026 to pay memberships through HSA funds, would you guys, as far as your business model, recommend still doing it as a group or allowing it to be like an add-on that individuals in an employer can sign up for?
I'll answer that if I can. We're going to keep our model the way it is. Transparently, because collecting money from individuals is the task. And we actually transparently tried an individual Prime membership, and it became kind of cumbersome. And so we're going to keep it with the employer-based model because it's easier for everyone and easier for us. And part of the problem, in my opinion, it's not the opinion of the next level or Dr. Priest, but part of the problem in healthcare is, like this time, part of the problem in healthcare is, it's just a bureaucracy of it all, right? And so one of the things that I know, and I'm speaking with Rafik Sanford, that we have a wonderful corporate headquarters in Houston. It's amazing. But we have a 4.5 in Houston for our employees. Half of the 4 floors for billing. And I tell people this all the time. If you're just a regular urgent care patient and you come see us, we're still the best urgent care in Texas. Not gonna lie to you about that. We're gonna take care of you. But we have, since day one, and I've been here since day one, had one global case rate with every care. One case rate. And so we still find ourselves having to send that same bill 3 or 4 times, even though we have one case rate. So we're just adding to the bureaucracy. So if we can go direct to consumer and work directly with the employers to cut down on the healthcare costs, and that's what we're going to do. We're very happy about the big, beautiful bill and the removal of the HSA dark cloud about how you're working with direct primary care. That's wonderful, and we've all been talking a bit about that. We're excited, but our model needs to stay the way it is because we just don't have we don't want to add more capacity to just find people who get their HSH.
Just to add one thing is that my goal from the beginning was to make this as inexpensive for an employer as possible. And so whenever we meet with employers, we tell them, look, the reason that we can do this so inexpensively, because even if you look at us compared to other direct primary care, the kind of market standard is somewhere between 75 and 95 PM, and we're more like 60 to 75 PM. It's a really huge difference. The reason that we can do that is because we expect payment timely, and we get paid before the beginning of the month. And once we have to hunt you down and beg you to pay the bills, I'm employing more people, I'm putting more costs into the system. So it's a partnership, right? So, but that's the way it works, and that's how we keep things low.
Any more questions, Sarah?
I just had a question about the expansion. Do you anticipate any price changes with contracting and expanding across the country for the price of home?
So that is such a great question, and I don't know that I have an answer for it right now. We are toying with different models because basically, if you sign up, it depends on who you sign up through, because we are going to allow other people to offer memberships in their regions to employers that we would otherwise have access to. They may have a completely different membership structure, and so if you have employees in Arizona, but you buy it through us here in Texas, then it will be our plan, and we will simply be using locations and paying a case rate to them, or when those employees access those in-person locations. But if you bought it in Arizona from someone who was selling it under their own label in Arizona, it may be a different plan with a different price. So that's I intend to keep next level pricing stable. It'd be awesome if we could make it lower, and we might be able to do that with add all the advent of the AI and everything. There's certainly some opportunities for technology to help us lower prices. I don't intend to increase prices, but I will say that it's a brave new world. I have no idea what it's going to be like when I'm partnering with other people. We're just going to see.
So just a follow-up question on that. So you mentioned that if they go through Arizona, then the pricing could potentially be different. Or does it still have the next level prime name, or is it going to be like co-branded?
No, if they buy it in Arizona for an Arizona population, but if the employer buys it through us in Texas, but they just have employees that are in Arizona, then they would be using our program. So it will be next level prime as long as they bought it from us. It's only something else if they buy it from someone else. And it's only a different price because that someone else may have a totally different program that has different components.
Lori Rice?
So the affiliates that you're talking about, one of the things is we don't do with the districts that we work with is they love Next Level Prime, they love the service, everything's so nice, it's
above and beyond. The concern is how do you control those affiliates and make sure that they're doing the same service, if not better, than what we're getting here? Because y'all are the town of, you like the Bentley, right? And it concerns me that they're either, Volvo's a good car,
Yeah.
but I want the Bentley.
Thank you so much. First of all, I'll flip you 20 after this. First of all, thank you for the compliment, but also the question is a really valid question. It's something that I struggled with and toyed with, and that was one of the reasons that it's taken us a while to kind of come up with this. But basically, the answer is technology. So I can't speak to like the look of the waiting room, right, or necessarily the friendliness of the staff. But what concerns me the most as a physician is I want the medical care to be consistent. I don't want someone to go into a clinic somewhere and get a different quality of care than they would get from us. So what we did was we have spent an enormous amount of time and money and energy on the technology platform that we overlay. So when our affiliate partners see a member, they are seeing them on our platform, and those medical providers are getting prompted by our technology to ensure that they are doing all the things that we would do. So it's amazing technology. I'm really super proud of it, and that's what's going to keep the care consistent. The other thing that we're toying with is sort of like an Uberish model where our members get to rate clinics, and so that we are able to control that a little bit. If our affiliate is getting bad ratings, then we can choose to turn them off, or we can choose to put them on notice, and that will actually raise the quality of care of the whole thing. I like it. I'm really excited about the collaborative nature of it. I don't know if it's going to work. I like everything moves in my head. Not necessarily the best idea.
Any other questions before we close? All right, I'm going to close with two things. I want to ask the panel one final question, and then I'm going to raffle off. Actually, I'm not going to raffle. I'm going to ask you guys a quiz question. But since this is San Antonio, they have a signed jersey that I'm going to ask you one question and a backup question. Whoever comes closest wins this jersey. Okay? All right. Because I know I grew up here, I know it's all about sports. Thank you for passing Project Mark. We didn't want them to leave. All right, last question for the panel, and if you guys can go just one by one, is and we'll start with you, Albert, on this and just go down, but if you were talking to an employer that was just evaluating Prime for the first time, what's the one piece of advice that you would give them about the process?
Take a chance. Certainly, it is worthwhile. You may not see the benefits right away, but with time, and as your staff starts to communicate the benefits and see that it actually is free care, they can go whenever they want. If there's access not 24/7, but more hours than you would have it with your primary care doctor. It really picks up pretty quickly. And that would be creative. Use it to help reduce your other, costs associated with healthcare within your health plan and what you can offer your employees. So it's certainly worth it to give it a shot.
Consider the implications of having a healthier workforce and what that could mean for your company.
I think y'all have heard enough from me, but I think you should just do it.
I would say simply that you truly have nothing to lose. One of the things I don't think that's been spoken about is there is a break-even cost guarantee with Next Level. So if you don't produce savings,
We've never had to do this, but if your employees don't use the program and you gain more than you would have spent on the medical care that they received, we will actually refund the difference.
so there's truly nothing to lose.
And I would never make that deal that I thought I was going to do.
So let me say that on the mic for everybody to hear this. She has a saying in our office, it's called skin in the game. We put skin in the game. So bottom line, if the total cost of your Prime program is more than what we saved you, be great to each other.
And then just to add to Beverly's point, the implication of having a healthier workforce, one of the things that I think is super important to consider when you're talking big picture, some of the data that they provide you in their monthly analysis is they ask the employees, where would you go if you didn't come here? And I have our annual data, utilization data from last year. 27.85% of our employees that were seen in the next level clinic said they would have gone nowhere. So that's a significant number of people that you've now just broadened their access to care. They're going to be healthier, and it just, I think it's.
For mine, if I was talking to another employer, I'd say be the hero. It's a no-brainer. For less than the equivalent of a $1 raise, or less than that, you can change their mind.
There may be some people out there who aren't as cavalier about this decision. I mean, definitely I can speak from personal experience that this was really awesome. My advice to an employer would be to do your homework. Take a look at the numbers, see what potentially you could save off of your health plans. And from that point, you're going to know that if you execute properly, that you're going to have a dividend at the end. And it'll be really easy. It'll be easier to convince the people you have to convince to go with the program.
Okay, now it's time for trivia. All right. So, I'm going to ask the first question. Everybody at their table has an Next Level notepad that you're required to take home with you. First and foremost, we don't want to take. All right. First and foremost. Of the 5 employers, not including Next Level, of the 5 employers, not including Next Level, what do you, in the annual savings, what do you think these 5 organizations have saved, their total savings combined, cumulatively, since 1/1 of this year? So what do you think their total savings is since 1/1 of this year until 11/30 of this year? That's all right. My pitch is off. All right. Everybody got a number? Yeah. All right. The second, and I need my team back there. This is second number is, what is the utilization percentage of the 5 groups combined? That's the tiebreaker.
Yeah.
Utilization of how much do you think their combined employees, you guys, what do you think is the utilization? What do you think the utilization is of 5 groups combined? All right, everybody ready? All right. Let's do my best auctioneer voice. Did anybody have 2 million or above? All right, smart people. Now we're listening. Okay. Did anybody have 4 million or above? You're out of here. All right. Did anybody have 3 million or above? Okay. Did anybody have $3.5 million? Of course, the financial guy. Of course. You have. You're over. It was like Price is Right. Sarah, what you got? You're both over. Okay. Is that the closest? Does anybody have any? You're over as well. Okay. So the tiebreaker is, what do you think the utilization is for the 5 groups combined? Sarah, I'll let you go first. 78. 78. Sarah, you get yourself a free Spurs shirt. All right, this is what our utilization rate looks like, just FYI real quick. This is the combined groups, and so they're at 71% since 1/1 of this year. And as you guys can see briefly that we're always tracking the data, but most importantly when we're looking at what the combined cumulative groups say, 3.587. So with the 68%, just with the 5 groups, and we have 305 people on the weight loss, 114 on the health coaching, and 89 on the mental health. So I want to close with this, because something that, Dr. Breeze just said, and I don't know if you guys picked up on it, but she just mentioned that she's trying to lower the cost. What? Well, no, I mean, but who hears that healthcare? Like, who is talking about lowering the cost of healthcare? I told this story at lunch because I had a chance to take some of the panelists out. I made the brave but foolish decision and dumb decision of leaving Dr. Breeze's side for 4 years. I helped start with her. She outworked me to death, and I was like, I need a break. So I went away. I went off to school for 4 years. And was working as part of the problem in the biotech space. But I say this when I came back, it's because I wanted to be part of the solution. I didn't want to be part of the problem anymore. Now, I've had almost every role at this organization besides IT in my time since we started. And one thing that I know about Dr. Breeze is that she's just going to be our hurricane in health, right? She's going to make it effective and affordable for everybody. That is not her goal. When we're looking at competition, people ask me, who's your competition? There really isn't anybody who's doing what we're doing. And so the fact that she says she's trying to drive it down is amazing to me, because I've known her for 13 years. I've never heard that before, but I believe it. I believe that she would do something like that. And the final thing that we did talk about is, and I wanted to speak to what we're doing in this organization, and I want to leave that slide up. As of 1/1, if you were 100% employer paid, you're paying for these benefits for your employees for Prime, for every employee that's on our weight loss program, she's giving a $20 credit back on your invoice every month for every member. So you're getting free money, even though the employee's paying for the program themselves in terms of the GLP-1. We're giving money back because those clients aren't going to need us as much or taking better care of their health. So there's going to be free money coming back to each of you that is enrolled in paying that 100% employee benefit for every one of your employees that's in our weight loss, or members that's in our weight loss program. That's unheard of. So again, I appreciate everybody coming out, and I thank you to our panel. I thank you guys for being here and taking time out of your day. And if there's any questions that you guys might have, there's some San Antonio sales team that's here. I'm here, Dr. Breeze is here. We have room until 5, and then we'll be here today. But we have room for the rest of the day, but please feel free to ask us questions, or we can schedule some time to chat with you later. But again, this is really what we wanted to do, is share from our own client's perspective how we're trying to make a difference in healthcare. We're only going to continue to grow and get better because of our partnerships with organizations like this. So thank you all for being here. Have a great rest of the week.